Arthritis is a debilitating condition that causes inflammation and stiffness in the joints. While there are many factors that can contribute to arthritis flare-ups, your diet plays a huge role. Certain foods are known to promote inflammation, which can worsen arthritis symptoms. In this post, we'll look at the top 6 inflammation-causing foods that may be triggering your arthritis flare-ups, often without you even realizing it. We'll also discuss some simple food swaps you can make to turn your diet into one that fights inflammation and eases your arthritis symptoms. Stay until the end because we have an exciting quiz to test your knowledge. Let's get started. Arthritis is extremely common, affecting over 54 million adults in the United States. The two most common types are osteoarthritis, caused by wear and tear on the joints, and rheumatoid arthritis, an autoimmune condition. Both involve painful inflammation in the joints. While medications can help manage symptoms, many patients find that adjusting their diet makes a big difference as well. The old saying, "You are what you eat," really applies when it comes to arthritis. Eating certain foods can trigger and worsen inflammation, while other foods have powerful anti-inflammatory effects. Making smart food choices can help reduce painful flares and improve joint mobility and function. Let's look at the top 6 inflammation-inducing foods to avoid. 1. Refined carbs and sugars. Refined carbohydrates like white bread, pasta, rice and baked goods are common culprits. They have been stripped of fiber and nutrients, leaving little besides starch that quickly breaks down into sugar. This leads to spikes in blood sugar and insulin that promote systemic inflammation. The sugars and refined carbs may also contribute to inflammation via advanced glycation end products, AGEs. These inflammatory compounds have been linked to arthritis flares and joint damage. Try swapping out refined grains for whole grain options like brown rice, quinoa, oats and 100% whole wheat bread and pasta. Limit sugary items like candy, baked goods, sugar-sweetened beverages and desserts. 2. Saturated fats. Foods high in saturated fat have been shown to activate inflammatory pathways in the body. These include fatty red meats like beef and pork, processed meats like sausage and deli meats, and high-fat dairy products like butter, ice cream and cheese. Try choosing leaner proteins like skinless chicken, fish, beans, nuts and seeds instead. Swap full-fat dairy for low-fat or non-dairy alternatives like almond milk and limit high-fat meat to a few times per month. 3. Vegetable oils. Vegetable oils like soybean, corn, cottonseed, sunflower, and canola oil are high in inflammatory omega-6 fatty acids. In excess, these may contribute to systemic inflammation. The oils are also heavily processed and unstable, forming free radicals and AGEs that worsen inflammation. Opt for extra virgin olive oil, avocado oil, and coconut oil for cooking. Drizzle olive oil on salads and veggies instead of oily dressings. 4. Alcohol. Alcohol is another contributor to inflammation, especially when consumed regularly and excessively. Beer, liquor, and wine all contain sugars that may also spike blood glucose. Plus, alcohol metabolism produces inflammatory chemicals called acetaldehyde and reactive oxygen species. If you choose to drink, limit to 1 drink per day for women and 2 for men maximum. Avoid alcohol during arthritis flares. 5. Processed and fried foods. Heavily processed foods and anything deep-fried are sources of AGEs and free radicals due to high heat processing and preservatives. They're often also loaded with vegetable oils, refined carbs, salt, and chemical additives. Favor fresh, whole foods instead. Aim to eat clean by limiting packaged and frozen items. Choose baked, steamed, or grilled foods over fried. Prepare meals at home where you control ingredients. 6. Excess sodium. Eating too much sodium has been associated with increased inflammation markers. Most soy sauce, salad dressings, sauces, canned and processed foods are high in sodium. Opt for reduced sodium options when possible. Read labels to check for high sodium items. Don't add extra salt when cooking or at the table. Use anti-inflammatory herbs, spices, lemon, and vinegar instead to add flavor. Making the switch. As you can see, many everyday foods can silently trigger and worsen arthritis, inflammation and pain. Simple diet tweaks like the ones discussed can make a world of difference in how you feel. Focus your diet on anti-inflammatory foods like fruits and vegetables, whole grains, beans, nuts, seeds, fatty fish and healthy oils like olive and avocado oil. Avoid processed and fried foods. Stay hydrated with water. Be sure to consult your doctor or dietitian if you have any food restrictions or nutrient concerns. With some simple substitutions to reduce inflammation foods and increase anti-inflammatory eats, you'll be well on your way to arthritis relief. Now, let's see how much you've learned with a quick quiz. Quiz. One. Which of these foods is considered an inflammation inducer that may trigger arthritis flares? A. Whole wheat bread. B. Sautéed chicken breast. C. Greek yogurt. D. Sugary baked goods. 2. What oil is considered the healthiest for cooking? A. Vegetable oil. B. Olive oil. C. Corn oil. D. Canola oil. Let me know how you did on the quiz. Comment your score below. Disclaimer. This content is for informational and educational purposes only. It should not be considered comprehensive, and the information provided does not constitute medical or other professional advice. Please consult a qualified healthcare professional for personalized input regarding nutrition and dietary changes for your unique needs. This content does not recommend or endorse any specific products, services, procedures, or treatment options. Reliance on any information provided in this post is solely at your own risk. Thank you for watching. Don't forget to like, subscribe and share.